All right, team. So this is now we're going to delve into the nurse concepts. I am going to give you bulleted what you need to know about each one of these to pass the CNA exam, and you're going to have multiple choice questions. This is just the refresher course you were looking for. Now, when you think of safety, you have patient safety, environmental safety, and worker safety. So this is not all encompassed. Remember what I said, I'm hitting the most important things. So let's talk about patient safety. You are going to get tons of questions pertaining to falls, all right? So what prevents a patient from falling, and not employer or employee falling, but the patient? One, remember non-skid socks. Those are the socks with the grips underneath. You need the socks, and when you see the skills, the socks are one of the supplies for ambulating, and ambulating means walking with the patient. And don't worry, you have plenty of quizzes just about vocab. What are the main causes for falls? One, somebody's trying to get to the bathroom. That's why you're supposed to toilet your patient every 2 hours. Toileting every 2 hours. Another, you're not watching your patient. CNAs are supposed to walk up and down and observe their patient every hour. Just lay eyes on them. So ask them if they need to use the bathroom every 2 hours. Observe them every hour. Another thing is that falls happen during change of shift. Everyone's trying to go home and the call light is ringing and patients fall. So remember those causes, okay? Now, a risk for fall is low blood pressure if they feel dizzy. That is why when you do the wheelchair activity, we say to check for if you're dizzy or lightheaded. Now, if somebody falls on the floor, you could guide them onto their floor, or if they're on the floor, you don't just quickly lift them up. You actually take vital signs of them while they're on the floor, make sure nothing's broken, they didn't hit their head, call the nurse and decide, because maybe you might not have to Hoyer them. You might have to Hoyer them off of the floor. All right, so those are questions pertaining to falls. Another thing under patient safety is checking the orders. Now, I'm not talking about medication orders because you're not a nurse. I'm talking about the orders on your Cardex or your plan of care. Just like a nurse takes orders from the doctor, you take orders from the nurse. So they have to tell you vital signs every 8 hours, or toilet every 2 hours, or feed a patient assist ×1. They give you how and your parameters on how you're supposed to work with the patient. Another area under patient safety is elopement. In your Alzheimer's patients' dementia unit, they're confused. So a lot of the doors have alarms, chair alarms, door alarms, and all of that is to prevent elopement. When someone is able to make it out of their unit or out of the nursing home or out of the hospital altogether, they have eloped. Safety, remember your basic life support or your CPR for choking. Hands around the neck is the universal sign for choking. And you stand behind them doing 5 back slaps and then 5 abdominal thrusts. All right. And you could review your CPR BLS. Delegation, the main question you could get around delegation means when somebody delegates or tells you to do something. So the nurse is telling you to do things by writing it on the plan of care. So 2 questions I find with delegation is that you have to make sure that the delegation is appropriate. So if it's something you've never been trained on or is not part of a nursing assistant's role, you can't do it. Another thing, CNAs are not allowed to delegate to each other. You can ask a fellow CNA for assistance, but you can't delegate to another CNA. You're both in the same role. An RN or LPN can delegate to you, but a nursing assistant cannot delegate to another nursing assistant. Another big item with patient safety, make sure that the equipment is low and locked, like bed low and locked when we do the skills, the wheelchair is locked, whatever the patient is in has to be locked. Also with equipment, when equipment is faulty, we tag the equipment, put it off to the side so that it could get repaired. So there's a few questions pertaining to equipment. Finally, in this one, patient safety restraints. Residents, when we go over the resident rights, residents have a right to be free of restraint. But if they are restrained, you don't just decide to restrain a resident. It has to be a doctor's order. The nurse will have it on the plan of care, and you have to be trained by that organizations on how to properly put on restraint. And now restraint, you have to check it every 2 hours to make sure that it's not too tight, especially those wrist restraints, okay? And you need a doctor's order. And so go back to your section because you will get 1 or 2 questions on restraints. So those are the biggest things pertaining to patient safety. But of course, every single skill that you do has a safety component, and we'll go over that.